and good afternoon, everyone. Welcome back. I'd like to welcome and introduce Dr. Robert Murphy, our Executive Director of the Havey Institute for Global Health and the John Philip Fair Professor of Infectious Diseases here at Northwestern's Feinberg School of Medicine, who of course answers your COVID questions every Tuesday and Thursday right here on the Havey Institute for Global Health's Facebook page. And today, Dr. Murphy will be answering viewer-submitted questions as well as addressing the latest COVID headlines through today, the 17th of March. And we invite you to continue to submit your questions to us, both via Facebook at NU Institute for Global Health or via email at globalhealthinstitute@northwestern.edu. And again, my name is Kristen. I'm the communications manager with the Institute, and I will be leading the discussion today. So Dr. Murphy, good afternoon. Thanks for joining us.
Good afternoon.
Diving right into the statistics, things are still looking good numbers-wise across the US. Vaccination rates, but just in the last 3 days, have increased slightly. We're still seeing around 1,400 deaths announced most days, but it's well below the peak of the Omicron wave. It looks like just yesterday, our new case numbers were just above 39,000, which is over a 50% decrease as we continue to see over the last 14 days. And it looks like every state across the US is in fairly good shape since the height of Omicron. So what can you tell us about this good news that we continue to see over these last few weeks?
I wouldn't call it good news. I would call it better news. 1,400 deaths per day is like 6 airplane crashes per day. That's not good. Now, death is the last marker, obviously. But the number of cases has gone down. That's terrific. But we're still having way too many cases. But they're going in the right direction here. And then we're going to talk about it a little bit later, what's happening around the world. Because it's obviously a global disease, and Europe seems to be a few weeks ahead of us all the time, Asia ahead of them, South Africa ahead of them. So we can watch what's happening around the world to help predict what's happening here.
Right. And as you said, it's not necessarily good news, while it is better at the moment.
Right.
However, with the news, and diving into our first headline, with the news of what's going on in the UK, it's a reminder that we should still be fairly cautious as we're not quite out of the gates yet. In the news, it looks as though COVID-19 infections across the UK and Europe are rising. Infectious disease experts are watching this BA2 variant, which is more transmissible than Omicron. What can you tell us about what's going on over in Europe right now?
Yeah, Europe, the cases are bumping up. They're really flying high in Asia. South Korea had over 600,000 cases yesterday. Now, they're not doing much about it because they have over 90% vaccinated, including the elderly. Hong Kong's having a huge spike in death rate because the elderly actually are very suspicious and didn't take the vaccine. So their death rate has just skyrocketed. Europe is just seeing more cases, up 48% in the UK and the Netherlands, 20% in Germany. And there's 3 big things behind this spike. One is the BA2 variant. That's the new variant of Omicron. It's approximately 30% more transmissible. So you're seeing this creep up. Supposedly in the United States, it's about 23% of all the cases, but that's more on the coast than it is in the Midwest. So here it's much less. But it's part of the reason why they're having this uptick in the cases. Other things that have been blamed on this uptick in Europe is that perhaps the immunity from the vaccine or prior infections is waning, it's going away. And they're all lifting restrictions just like we are. And like I mentioned in South Korea, they're lifting them even though they're having a record number of cases, but they're not having very many deaths because they're all vaccinated. So it's it's always a couple of things in a pandemic. It's never any one thing that's driving this thing. But I think the take-home point is it's not over yet. And we've got to watch this. We still have too many deaths. We still have too many cases. They're going down now. Enjoy your time now, because it's very likely that the cases are going to go up again. And then the question is, what are we going to do? Most likely what will happen at some point is that there will be a return to mask mandates in indoor confined settings. Outdoors, we don't have to worry about too much. And that will be another thing that drives cases down as the weather continues to improve and more people are outside, things are better ventilated. That's also going to help.
Absolutely. Spring is coming. Our second headline, we talked a little bit about this Tuesday, and I know folks are fairly interested in this wastewater. So percentages have changed here in Illinois in the COVID-19 levels detected in wastewater. What can you tell us about these rising levels in Cook County, and what does this mean?
So wastewater, why are we checking it in wastewater? Well, ultimately the virus ends up either being swallowed, it ends up, in your body fluids, and it ends up in the wastewater. So they've been screening for wastewater, and it's been shown to be higher in places where there's a lot of cases. So it is a sentinel sign that more people are infected in a certain area when they're testing the wastewater. So say they're checking city A versus B. In A, all of a sudden the wastewater numbers go up. Otherwise, the cities are behaving the same. But then all of a sudden, they would expect an uptick in city A. In other words, it's a very early signal of more and more people getting infected. That's what it is. Okay, and that's been shown to be a good marker of a upcoming infection. If it goes down, that's a good sign. That means fewer people are infected. And there's wastewater surveillance all over the United States now and the world. There's 688 wastewater sites now, and 2% are showing an increase. So that's not that much, but people are seeing it. And again, it looks like it's more on the, it's not uniform across the United States.
Interesting. Our third headline, so we talked a little bit about the BA.2 variant. Israel's health ministry had said that 2 travelers recently tested positive for this new variant. What can you tell us about the symptoms of this variant? How does it differ from Omicron based on what we know at this point of folks that have been infected with this variant?
This virus continues to mutate. It mutates constantly. And there's a new variant that the Israelis have found called BA.2.2. And there's going to be a BA.2.3. It's the natural process of the virus. They're trying to make a big deal about, well, it's more fatigue, it's more this symptom or that symptom. There's not enough cases to really make that claim. And plus, your symptoms are really going to depend on your immune system. So if you've had COVID before, or if you've been fully vaccinated and been fully boosted, that's all going to mix in there. So I think this whole focus on the symptoms is way too premature. It's COVID, and it's another one of the variants that's coming out there and could be coming to your town soon, but we'll see.
And another reminder that vaccinations help.
Yes.
Moving into our viewer submitted questions today. So the first one, we've got an individual who is a general dentist. They've noticed that every 2 weeks, positive cases in Illinois are dropping by half. As we have noted each segment, the cases have continued to drop. They're wondering if that continues, looking at about May of this year, there should be about 500 positive occurring cases reported. Do you see this as a trend? And secondly, as there will always be positive cases, what approximate number of positive cases do you think that would make COVID no longer considered a risk to the public?
It's a good question. Yes, it's definitely a trend going in the right direction. Numbers are coming down. However, there's still a lot of numbers that are tumbling. There's still cases out there. There's still people dying from this disease, but it is a trend. And the big question is, how low does it go? And how long does it stay down? We often refer to, as the cases are coming down, it starts to slow down and there's a tail on the number of cases. In other words, it doesn't go down to zero. So how big is the tail? And how low is low? And so the second part of the question, what number of positive cases do you find that's no longer a risk to the public? Well, of course, zero. You don't want any cases because the thing is so transmissible. Now, if you look at overall public health risk, when you get down to less than 15 cases per 100,000 people, that's pretty low. That puts your risk is really very low. And so that's a number that kind of sticks out and triggers those red periods and yellow periods and green periods. And we're mostly in the green now, the good, and those, because those numbers are down. It's per 100,000 population, and 15 is kind of a number that's been looked at very closely. So, but you really want to be down, you really want zero.
Right. 0 cases would be the phenomenal. Our second question, this individual has noted about the media and what they keep saying about warm weather and how it affects the number of positive cases that we're seeing. We even just recently mentioned that ourselves. With the warm weather coming back, the numbers tend to fall, and in the fall and winter, they might go back up again. This individual is wondering why warmer climates, so places in the US such as Florida, why wouldn't they have had lower COVID rates during these times than they did?
Yeah, this is normal logic, but it's too complicated. First of all, the number of cases is impacted by the vaccination rate. It's also impacted by mitigation strategies, if there are any. Right now, they're all being lifted for the most part. In warm weather, many of these respiratory infections are cold weather infections. The flu comes in November, December, January, almost every year. There's sporadic cases at other times, but not too many. COVID, we thought, oh yeah, it's going to be another respiratory thing. It's going to be mostly in the winter. And what about winter? Well, people are indoors, they're congregating indoors more. They're not outside. The ventilation is not as good. So they blame a lot of it on that. Now, in the case of Florida, the problem in the summer is that it's so hot down there. Texas too, the whole southern part of the United States, people are indoors a lot in the summer, in air conditioning, with the air blowing around, and they're in crowded spaces, restaurants and other venues with air blowing indoors. So the hot weather can actually work against limiting the transmission if it pushes everybody indoors. So anyway, it's a much more complicated question. I think we really learned our lesson last year. If you remember, in June and around July 4th, Lollapalooza here in Chicago, and people were, it's over. You had Scott Gottlieb, the former FDA director, say there's no more waves coming. It's over, or getting over, whatever. Scott Gottlieb is a great guy. I really admire him. But a lot of people were really very hopeful last summer that this was the end. Especially when the Lollapalooza thing had all those hundreds of thousands of people and hardly anybody really got infected.
Right.
That all changed in August, the hottest month of the year in many places. And what happened? Delta, a new variant, more contagious, more deadly. And before kids even had a chance to go back to school and congregating and spreading it even more, we had the Delta wave. And then the wave wasn't even over before Omicron came. And that was in the end of, it started in November, but it got here big time at the end, by the end of December. By January, we had taken over. And we had that massive Omicron spike, and vaccinated and unvaccinated, and the hospitals were full again. I mean, it was really crazy. But the point is, these waves can come at any time, summer or winter. And so it's not the usual respiratory virus infection, because there's too many other factors involved in the spread of this thing. This thing is now so contagious. It's very close to being as contagious as measles, which is highly contagious. And this is almost just as bad. So this Omicron and Omicron variants are really been the big game changers in this whole thing, even though the Omicron is less severe, but the number of cases is like way higher. And so it stressed out the hospital system again, and it really decimated the unvaccinated group and caused a lot of deaths.
Let's move on to our third question. So this individual is wondering if there are any studies on the effect of proper use of monoclonal antibody infusions or antivirals on long-haul COVID, and on their effectiveness of preventing reinfection for some period of time. Anything you can tell us about that?
Well, I'd say there's not a lot of studies on it. It needs to be studied. We know that in the vaccinated, that the long haul COVID is less, maybe by as much as a half. It's really an area of intense interest right now and intense research. So I can't answer it exactly right now, but it's less. In the case of the monoclonal antibodies and the antivirals, you know, if the immunologic response is blunted by the antivirals, you know, that could mean one of two things. One is that, you know, if the virus is cleared faster, maybe there's not as strong as immunologic response. And if the immunologic response is associated with long haul COVID, then you know, there's either going to be more or less of long haul COVID. You know, it depends what's causing the long haul symptoms. But in general, we know that the vaccines are associated with less. That's for sure. And we don't know about the treatments now. It's just, I can't answer the question because I don't know.
Sure. Well, hopefully more is to come, and we'll find out more again, as we always say, of long haul COVID and what we really know about it in the coming months. For our last question, we have a viewer following up from our Tuesday segment where we discussed the wastewater, which I know we discussed again today. This individual is wondering about, with the increase in COVID being found in wastewater, the number of cases yet continue to drop. And they are wondering if wouldn't we see an increase in cases in the areas where COVID is found in wastewater because folks would already be infected. It seems like cases in wastewater would be increasing at the same time, and they feel as though they misunderstood. Any way you could clarify?
It's really hard to wrap your head around, why are we measuring wastewater? Wastewater is just a signal that there's COVID in your community or wherever they're measuring the levels. And they get a concentration. Sometimes there's nothing. Well, of course, that would be the best. But they may pick up COVID. It may be the first thing that gets picked up. Maybe the first signal that there's COVID in your community. So it'll occur early in a little blip up in your town or your region or whatever. So it's just a marker, and it'll help us because we're such a huge country geographically, and we have 330 some million people. And if some areas are popping up, plus they'll be able to do the genotype on it to figure out what type of COVID it is in a certain area. It'll give us that information earlier rather than waiting for people to get infected, to develop symptoms, to end up getting tested, to end up in the hospital. So all that takes weeks to months. And so if you look in the wastewater, you're going to get it, you'll get it really early. So it's just an early marker, a public health marker that there's COVID in your community.
Absolutely. Well, thanks for clarifying, Dr. Murphy. That was our last question for today. So that concludes our segment. Thank you very much.
Okay, thank you. There's no shortage of stories, even though it's dropped off a lot of people's radar. But I think we'll keep reporting. You know, we'll see what happens. It's likely that we're going to get the same kind of bump up that they're seeing in Europe. And the question is this going to be a big bump or a little bump?
Absolutely.
Hopefully a little one.
Hopefully. Well, thanks everyone, and we'll see you back next Tuesday.
Great. Have a good day.